Next topic is the pleura on lungs. So pleura is the serous covering for the lungs, and it is made up of two layers, the parietal layer and the visceral layer. Like the parietal and visceral layer of body cavities, they are coming from, yes, the somatic layer of lateral mesoderm and the splanchnopluric layer of lateral mesoderm. So from the lateral mesoderm, we have two layers, somatic layer and the splanchnopluric layer. Splanchnopluric layer. Splanchnopluric layer. So the parietal pleura is coming from the somatic layer of lateral mesoderm, and the visceral pleura is coming from splanchnopluric layer of lateral mesoderm. So visceral pleura is very close to lungs. Okay. And they take the nerve supply from the lungs. Autonomic nervous system supply the visceral pleura. Now what about the parietal pleura? See, the parietal pleura, depending upon the region present, we are giving different names. We have 4 types of the parietal pleura. What are those? Cervical pleura, costal pleura, diaphragmatic pleura, and the mediastinal pleura. See, same parietal pleura only, depending upon the region it is covering, it is called cervical pleura, costal pleura, diaphragmatic pleura, and the mediastinal pleura. Now, what about the cervical pleura? Cervical pleura, which covers the apex of the lung. Okay, costal pleura, which covers the anterior surface of the lung, or the costal surface of the lung, anterior surface of the lung. Diaphragmatic pleura covers the diaphragmatic surface of the lung, which covers the diaphragmatic surface of the lung, whereas mediastinal pleura covers the mediastinal surface of the lung, covers mediastinal surface of the lungs. Okay, right. So depending upon the region present, we are giving different names for the parietal pleura. Clear? Right. So now we see one by one. First one, cervical pleura. I told you just now, cervical pleura covers the apex of the lung. Now above the cervical pleura, we have one membrane. What is the name of the membrane? Simpson's fascia or suprapleural membrane. So suprapleural membrane or Simpson's fascia, which present above the cervical pleura, which present above the cervical pleura. Now Simpson's fascia, also known as suprapleural membrane. We have other name. Please remember the other name. Okay. So Simpson's fascia, also called suprapleural membrane. Now this Simpson's fascia suprapleural membrane is nothing but, which is the degenerated part of, which is the degenerated part of one muscle. Which muscle? Scalenus medius muscle. And that is a question we got in 2018 NEET exam. They gave the Simpson's fascia, it is a degenerated part of scalenus anterior. That is wrong. Simpson's fascia is coming from scalenus medius muscle, degenerated part of scalenus medius muscle. Okay, right. Now, next one. Now, the Simpson's fascia, it is extending from the inner border of the first rib and which goes up to C7 transverse process. This is very important. Now, first rib is connected to first thoracic vertebra. Okay, but this membrane, this fascia, Simpson's fascia, which is extending from the inner border of the first rib to the C7 vertebra, not to T1. So please write, the Simpson's fascia is extending from the inner border of the first rib, up to the C7 transverse process. C7 transverse process. Okay. It is not connected to T1 vertebra. That is the point. First rib to the C7 vertebra. Okay. Right. Now, the cervical pleura is separated from the subclavian artery, subclavian vein by the Simpson's fascia. So Simpson's fascia separate cervical pleura from subclavian artery and the subclavian vein. So these are some basic points you have to know about the Simpson's fascia. Okay. Now again in the NEET exam they may ask you. Now that's all about the cervical pleura and the Simpson's fascia. Next, we're going to see the mediastinal pleura and diaphragmatic pleura. I told you just now, the same pleura only, the parietal pleura only, if it is present in the front side, that is called costal pleura. If it goes medially, that is called mediastinal pleura. If it goes inferiorly, that is called diaphragmatic pleura. So now we're going to discuss at which point the costal pleura turning as mediastinal pleura. So we're going to draw the two line of reflection. Number one, costo-mediastinal line of reflection. Costo-mediastinal line of reflection. Okay. So this line is nothing but the costal pleura turns medially as a mediastinal pleura. Okay. Now we're going to start from sternoclavicular junction. Sternoclavicular junction, right side and the left side. Now from the right side, we have to draw one vertical line up to fourth costal cartilage. Left side, we have to start from left sternoclavicular junction up to fourth costal cartilage. Now from fourth costal cartilage on the right side, we're going to extend the line up to seventh costal cartilage. That's all. That is the costo-mediastinal line of reflection on the right side. Now from this line, the costal pleura turns medially and that is called mediastinal pleura. Now this line is called costo-mediastinal line of reflection on the right side. Now this line we have to draw from right sternoclavicular junction. We have to draw one vertical line up to seventh costal cartilage. That's all. Now come to left side. Left side, the starting point is same. Starting from sternoclavicular junction, left side. And we have to draw one vertical line up to fourth costal cartilage. Okay. Now from fourth costal cartilage, we have to deviate the line just to 2 to 2.5 millimeter. And we have to reach up to sixth costal cartilage. 2 to 2.5 millimeter. We have to deviate the line and we have to reach sixth costal cartilage. Now this line is called costo-mediastinal line of reflection on the left side. Very simple. From the left side sternoclavicular junction, you have to draw a vertical line up to fourth costal cartilage, left to fourth costal cartilage, and we have to deviate the line 2 to 2.5 millimeter, and we have to reach up to sixth costal cartilage. Okay? Any doubt? No. Now, that's all about the costo-mediastinal line of reflection. Again, left side, why we are deviating the line 2 to 2.5 millimeter? Because of the heart. Heart is present. So we are deviating 2 to 2.5 millimeter and we have to reach sixth costal cartilage. Clear? Now, next one, we're going to draw costo-diaphragmatic line of reflection. Now from this line, the costal pleura goes inferiorly and continues as diaphragmatic pleura. So costo-diaphragmatic line of reflection. Now for this, we're going to take 3 points, mid-clavicular line and then mid-axillary line and scapular line. Okay. Now right side, from the seventh costal cartilage, we have to come to mid-clavicular line. The mid-clavicular line, we have to mark at the 8th rib and mid-axillary line 10th rib, scapular line 12th rib. So if you connect these points, now this point is called costo-diaphragmatic line of reflection. Okay. So 8th rib in the mid-clavicular line, 10th rib in the mid-axillary line and the 12th rib in the scapular line. Now same points for the left side. From the 6th costal cartilage, yes, again 8th rib in the mid-clavicular line, 10th rib in the mid-axillary line, and 12th rib in the scapular line. Okay. Shall we proceed? Then what's the difference between left side and right side? Left side, we are starting from 6th costal cartilage. Right side, we are starting from 7th costal cartilage. That is the only difference. The remaining points are same on the right side and left side. Okay. Now what about the lungs? The lower border of lungs. See, the inferior border of the lungs will be like this. It is the inferior border of the lung. Now, inferior border of the lung, 6th rib in the, that is the inferior border of the lungs. Inferior border of the lungs. So, inferior border of the lungs, 6th rib in the mid-clavicular line, 8th rib in the mid-axillary line, and 10th rib in the scapular line. Okay, that is the inferior border of the lung. I told you, close to the lungs, we have visceral pleura. Now, between visceral pleura and parietal pleura, now we have a space. Now, this space is called costo-diaphragmatic recess. Costo-diaphragmatic recess. So, costo-diaphragmatic recess is present between the inferior border of the lung and the diaphragmatic pleura. Okay. Now, between the visceral pleura and the parietal pleura, we have the pleural cavity, which contains pleural fluid. Okay. Now, you want to take the pleural fluid. You want to drain the pleural fluid. The patient is having pleural effusion. Now, where are you going to pass the needle? See, the lungs lower border, 8th rib in the mid-axillary line, and the parietal pleura, 10th rib in the mid-axillary line. So, between 8th rib and the 10th rib, we have 9th rib. So, you can do the pleural tapping between 8th rib and 9th rib, and the 9th rib and the 10th rib. So, pleural tapping, it is done. Pleural tapping, it is done in the 8th intercostal space, 8th intercostal space or 9th intercostal space. So, we can do the pleural tapping in any of these space, but most commonly it is done in the 8th intercostal space. Okay. So, that is where we do pleural tapping. In which line? Mid-axillary line. Okay. Right. That's all about the line of reflections. And we also discussed the costo-diaphragmatic recess. Next, we also have one more recess called the costo-mediastinal recess. Now, costo-mediastinal recess, it is present between the costal pleura and the mediastinal pleura. Now, this is present behind the sternum and the costal cartilage. Now, you can see this in the region of the cardiac notch of the left lung. It is very obvious there only. Okay. So, it is very obvious in the region of the cardiac notch of the, yes, the left lung. That's all about the costo-mediastinal recess. Now, one last thing is pending, nerve supply of pleura. Okay. So, nerve supply of pleura, see here. Now, this is the lung. This is the visceral pleura. And we have the parietal pleura. Now, the visceral pleura, it is supplied by autonomic nervous system, which takes the nerve supply of lung. Okay. Now, what about the parietal pleura? Now, this is our costal pleura. This is diaphragmatic pleura. And this is mediastinal pleura. Okay. So, now this costal pleura and this costal pleura and the peripheral part of diaphragmatic pleura and the peripheral part of diaphragmatic pleura, it is supplied by intercostal nerves. Intercostal nerves supply the costal pleura and the peripheral part of diaphragmatic pleura. Now, the mediastinal pleura and the central part of the diaphragmatic pleura, it is supplied by phrenic nerve. So, mediastinal pleura plus the central part of the diaphragmatic pleura, it is supplied by which nerve? Phrenic nerve. Okay. So that's all about the nerve supply of pleura. Very simple. Just draw the diagram. Costal pleura and the peripheral part of diaphragmatic pleura, intercostal nerve, mediastinal pleura, a central part of diaphragmatic pleura supplied by phrenic nerve. Okay, right. So that's all about the pleura. Next, we're going to see lungs. See, lungs, we're going to concentrate mainly on the mediastinal surface. So that is where we get questions. Now, see the diagram. So now we are seeing the mediastinal surface of the right lung. Now, the first and foremost thing, the structures arranged in hilum. So now this is the hilum. This is the hilum of right lung. That is the hilum of the right lung. Okay. So now how the structures are arranged in the hilum of right lung from above downwards. So first thing, from above downwards. The uppermost structure in the hilum of right lung is epiarterial bronchus. Epiarterial bronchus. Okay. Okay. And then pulmonary artery. And then hypoarterial bronchus. Below the artery we see bronchus. Hypoarterial bronchus. And last one, lower pulmonary veins. That is our lower pulmonary veins. Lower pulmonary veins. So this is arrangement of structures in the hilum of right lung. In front of the hilum of right lung, I told in the head and neck itself, in front of the hilum of lungs, what we have? Phrenic nerve, very good. And accompanied by pericardiophonic vessels. Pericardiophonic vessels. Now behind the hilum of lung, we have vagus nerve. So this right side, so right vagus nerve, and this is right phrenic nerve. Now this is anterior and this is posterior. Okay. So in front of the hilum of right lung, what we have? Right phrenic nerve and right pericardiophonic vessels. Now behind the hilum of right lung, right vagus nerve. Clear? Now see the diagram. Now this is the diagram. Now this is our, I'm going to mark, this is number 1. That is our epiarterial bronchus. This is pulmonary artery. This is hypoarterial bronchus. And this is lower pulmonary vein. Right. Now the arrangement of structures from above downwards, it is variable in the right lung and the left lung. But the structures arranged in the hilum of lung from anterior to posterior, it is same on the right lung and left lung. Okay. So structures arranged in the hilum of both right lung and left lung. Right lung and the left lung from anterior to posterior is same. Okay. So structures arranged in the hilum of the right lung and left lung from anterior to posterior, it is same. The anterior-most structure, see the diagram? Now this is anterior and this is posterior. The posterior border is blunt. Anterior border is sharp. Okay. So that is why I am writing this is anterior and posterior. Now the anterior-most structure in the hilum of the right lung and left lung is pulmonary vein, followed by pulmonary artery, followed by bronchus. And the posterior-most structure is bronchial artery. Bronchial artery, it is not seen in the diagram. We mark the artery. Now bronchial artery will be like this. So that is our bronchial artery. Okay. So this is our bronchial artery. So bronchial artery, it is a posterior-most structure in the hilum of both right lung and left lung. Same arrangement you see on the left lung from anterior to posterior. The anterior-most structure in the hilum of left lung is the pulmonary vein, pulmonary artery, bronchus, and the bronchial artery. Okay, right. That's all. Now, in the front of the hilum of the right lung, we have the cardiac surface. Now, this cardiac surface, it is, which part of the heart is related here? That is our right atrium. It is mainly The cardiac surface is in front of the hilum of right lung, the cardiac surface. Now, which part of the heart is related here? Right atrium. Okay. Now, above the cardiac impression, you see one vertical groove. Can you see the vertical groove here? Yes. Now, this is the vertical groove above the cardiac impression. The lower part of the vertical groove is for superior vena cava, and the upper part of the vertical groove is for right brachiocephalic vein. That is our right brachiocephalic vein. Right brachiocephalic vein. Clear? Right. Now, above the hilum, we are seeing one arch. Above the hilum of right lung, we see the arch, and that arch is for the arch of Asayas vein. That is the arch of Asayas vein. Okay? Right. Now, behind the hilum of the right lung, we have the vertical impression for esophagus. So, esophageal impression is present behind the hilum of right lung. Okay? Right. So, one last point, postero-inferior part of the cardiac impression, postero-inferior part of the cardiac surface is having the groove for inferior vena cava. So, posterior-inferior part of the cardiac surface having one small groove, that groove is for inferior vena cava. Okay? Right. So, these are the structures you have to remember. These are the relations you have to remember for the mediastinal surface of the right lung. Okay? Right. Now, next, left lung. So, left lung, again, first, the arrangement of structures in the hilum from above downwards. So, this is the hilum of the left lung, mediastinal surface. The uppermost structure in the hilum of left lung is pulmonary artery. Pulmonary artery. Now, below the pulmonary artery, we are seeing the hypoarterial bronchus. Hypoarterial bronchus. Okay, and the lowermost structure is our lower pulmonary vein. Lower pulmonary vein. Okay, right. Next, this is anterior and this is posterior. Now, anterior to the hilum of left lung, we have a nerve. Which nerve? Our left phrenic nerve. Now, left phrenic nerve is accompanied by left pericardiophonic vessels. Left pericardiophonic vessels. Okay. Now, behind the hilum of left lung, we have left vagus nerve. Yes, that's all. So, in front of hilum of lung, phrenic nerve. Behind the hilum of lung, vagus nerve. Yes. See the diagram. Now, the arrangement of structures in the hilum of left lung. The uppermost structure is a pulmonary artery, and then bronchus, hypoarterial bronchus, and then lower pulmonary veins. Now, this is anterior border and this is posterior border. Now, in front of the hilum of left lung, we have the cardiac surface. Now, which part of the heart is related here? Now, our left ventricle. So, left ventricle is related to cardiac surface. Now, above the hilum, we are seeing one arch impression, and that is for arch of aorta. So, arch of aorta, it is an arch impression above the hilum of left lung. This is very important. See, above the hilum of right lung, we have arch, and that arch is for arch of Asayas vein. Above the hilum of left lung, we have an arch, and that arch is for arch of aorta. Very good. Now, behind the hilum, we are seeing the vertical impression for descending thoracic aorta. So, descending thoracic aorta, which is present, which is related posterior to the hilum of left lung. Okay, right. Next, from the arch of aorta, we see vertical impression. That vertical impression is for, so we have a groove for left subclavian artery, and that is the vertical groove above the arch of aorta. Okay. Now, behind the groove for left subclavian artery. Now we have the impression for esophagus. So esophageal impression, again it is a vertical groove, okay, behind the left subclavian artery groove. Okay, right. Again, behind the hilum, we are not seeing the impression for esophagus. Why, sir? Now esophagus is rated to right lung behind the hilum of lung. Okay, esophageal impression you see behind the hilum of right lung. Behind the hilum of left lung, we have impression for descending thoracic aorta. Okay, right. And one last point. Now this is our pulmonary ligament. Pulmonary ligament. And this is impression for descending thoracic aorta. Now between the pulmonary ligament and the impression for descending thoracic aorta, we have one small vertical groove, and again that vertical groove is for esophagus. So esophageal relations you see 2 times in the mediastinal surface of the left lung. Right side, we have only one impression for esophagus behind the hilum of right lung. That's all over. But left side, we have the 2 impressions for esophagus. Behind the groove for left subclavian artery, we have small impression for esophagus. And between the pulmonary ligament and the impression for descending thoracic aorta, we have a small vertical groove, and the small vertical groove is for esophagus. So that's all about the mediastinal surface of the left lung. So one last topic in the lungs is the bronchopulmonary segment. Now what is meant by bronchopulmonary segment? Now see the diagram. Now this is trachea, and the trachea is bifurcating into right bronchus and the left bronchus. So right bronchus, it is in more vertical in the trachea. So any foreign body entering the trachea will go to right bronchus. Now there is a primary bronchus, right bronchus, left bronchus. Now the primary bronchus, which in turn divided into secondary bronchus. Now the secondary bronchus, which is also called lobar bronchus. That means they go to the corresponding lobes of the lung. Right side, right lung, we have 3 lobes, upper lobe, middle lobe and lower lobe. So we have 3 lobar bronchus for the right side. Left side, we have only 2 lobes, upper lobe and the lower lobe. So we have 2 lobar bronchus for the left side. Now these lobar bronchus, which in turn divided into tertiary bronchus. Now tertiary bronchus, which is also known as segmental bronchus. So now what is the definition for the bronchopulmonary segment? So the part of lung which is aerated by the tertiary bronchus. Now this is a lung. This part of lung is aerated by this tertiary bronchus. That is called bronchopulmonary segment. So what is bronchopulmonary segment? It is the part of lung which is aerated by segmental bronchus. Which is aerated by segmental bronchus. That is called bronchopulmonary segment. Okay, right. So now see the diagram. Now this is one bronchopulmonary segment. Now between the bronchopulmonary segment, in the intersegmental plane, you have one structure. What structure? Pulmonary vein. So pulmonary vein, it is present between the segment. Okay. So pulmonary vein, the tributaries are intersegmental. That is very important. So any structure with the surgical importance will be the question. Now why pulmonary vein is intersegmental? Why we have to know this, and why they are asking this question again and again? Because any infection or any cancer will be limited to some bronchopulmonary segment. Suppose you are planned to remove some cancer segments in the lung. I told you the pulmonary vein is intersegmental. The surgeon first try to identify the pulmonary vein only. So the pulmonary vein is present between the segments. So if they identify the pulmonary vein, means they are present between the segments. So pulmonary vein help to identify the segments. Okay, that is why they are asking this question again and again. So pulmonary vein is intersegmental. Okay. Now what about the pulmonary artery? So pulmonary artery is intrasegmental. So pulmonary artery is intrasegmental. Okay. Pulmonary artery intrasegmental. Pulmonary vein intersegmental. Clear? Right. Now, next one. What are all the bronchopulmonary segments we have in the right side and left side? So now in the right lung, we have upper lobe, middle lobe, and the lower lobe. Now, how many segments present in the upper lobe? We have 3 segments. What are those? Apical, anterior, and posterior. 3 segments. Middle lobe, 2 segments. Lateral and medial. Lower lobe, we have 5 segments. Superior, anterior basal, lateral basal, posterior basal, and medial basal. Okay, superior, anterior basal, posterior basal, medial basal, and lateral basal. Okay, right. So these are the segments present in the right lung. What about the left lung? Left lung. So left lung, we have upper lobe and the lower lobe. Okay, now what are the segments present in the upper lobe? We have apical, anterior, and posterior. Apical, anterior, and posterior. Sometimes the apical and posterior, they fuse together to form apico-posterior. Okay, now we also have superior lingular and the inferior lingular. So upper lobe of the left lung have 5 segments: apical, anterior, posterior, superior lingular, and the inferior lingular. Sometimes the apical and posterior, they fuse together to form apico-posterior. Okay, now the superior lingular and the inferior lingular, which corresponds to the middle lobe of right lung. Middle lobe of right lung. Okay, right. Now lower lobe, again we have superior, anterior basal, lateral basal, posterior basal, and also we have medial basal. Now medial basal, it is not well developed in the left lung. Why, sir? Because of the heart. So this medial basal fused with the anterior basal to form anteromedial basal. Okay, right. Now one last point in the bronchopulmonary segment is the dependent bronchopulmonary segment. See, we have dependent bronchopulmonary segment. We have different dependent bronchopulmonary segment for standing position and supine position. Okay, I told you, any foreign body entering the trachea go to right bronchus, right lung. Now in right lung, which lobe? Lower lobe of right lung. Now in the lower lobe of right lung, we have 5 segment. Okay. Now what is the dependent bronchopulmonary segment in the standing position? We have a mnemonic. Mnemonic is SPB is a mnemonic. So SP Balasubramaniam is legendary singer. Yes. And that is a mnemonic to remember the dependent bronchopulmonary segment in standing position. Now the point is, even for supine position, the starting letter is S. Standing position, the starting letter is S. So this is a right mnemonic, sir. Yes, this is a right mnemonic. How, sir? See, SPB I told you is legendary singer. So any singer will sing song in which position? Not in the supine position. It is humanly impossible for any singer to sing in supine position. So the singers, they sing only in which position? Standing position. So dependent bronchopulmonary segment in standing position is posterior basal of the lower lobe of right lung. Clear? Right. The dependent bronchopulmonary segment in the supine position is the superior segment of the lower lobe of right lung. Superior segment in the lower lobe of right lung. That's the dependent bronchopulmonary segment in supine position. Okay, and this question we got in 2021 INCT exam. Okay, right. 2021 November INCT we got this question. And that's all about the bronchopulmonary segment. In the recent exams, they're asking mainly this one only, the dependent bronchopulmonary segment in standing position and supine position. Repeatedly, yeah, we're getting this question. Okay, that's all about the bronchopulmonary segment, and that's all about the pleura and lungs.